Hi, I'm Logan Easterday. I'm a nurse practitioner student with Northern Kentucky University. What is your first and last name?
Donald Wagner,
What is your date of birth?
8/14/1971,
Okay, and what is the current date?
December 1st, 2019.
Okay, who's our current president?
Donald Trump.
Perfect. And what are we doing?
Just kind of an overall physical.
Where are we at?
We're at a hospital.
Perfect. Okay. So as walking up, I see that the patient's overall appearance is generally healthy, skin looks intact, the weight is within average range. So we'll talk to the patient. I'm going to go ahead and tell you that I'm going to get some vital signs and do a quick assessment. Is that okay?
Okay.
Okay. Okay. 126 over 68. I'm going to get your heart rate, and I'm going to listen for your respirations at the same time. I'm going to watch the clock. Okay. Heart rate is 86, and respirations is about 18. Next, we're going to start from head to toe. So I'm going to see your head looks normal cephalic. Do you have any problems with bruising, bleeding, oozing from eyes, nose, ears, dry mouth, dry eyes, dizziness,
No.
any nausea, vomiting, any sort of abdominal pain, any complaints with that?
No.
Okay, perfect. So we're going to start with palpation of the head. So I don't see any indentations, no abnormalities, no cuts, no bruises. And then we'll start with the general appearance of the ears. I don't see any bruising behind the ears, no battle signs, no raccoon eyes, no battle scars, no drainage from the ears, no abnormal redness. Ears look both symmetrical and intact. We're going to go ahead and just look inside your ears real quick with just a little scope. Okay. Normal crewman, and tympanic membrane is gray and intact. Same on that side. Normal amount of earwax crewman and tympanic membrane is intact. Next, we're going to do a Weber-Benet's test with this little thing. So I'm going to tap it, put it on your head. You tell me if you hear it in one ear or both ears.
Both.
Perfect. So then we're going to do both sides of the ears. So I'm going to tap it. This is 1. This is 2. Which one is louder?
2.
Okay. Same on this side. This is 1. This is 2. Which is
2.
louder? Perfect. Okay. Next, we're going to follow this down. So I'm going to see the TMJ. Any complaints of jaw pain, abnormal crunching, grinding feelings?
No.
Okay. Open your mouth one. Close your mouth. Perfect. Next, we're going to just palpate the lymph nodes. We're going to start with the preauricular, which is in front of the ear, postauricular. We're going to do the occipital, submental, submandibular, jugulo-digastric, superficial clavicular, posterior cervical, clavicular chain, and then clavicular right here, the subclavicular. So I don't feel anything negative for lymphadenopathy, no masses, which is a normal finding with that. Next, we're going to look at your eyes, and actually we're going to do olfactory central nervous system number 1. I'm going to have you close your eyes, and you're going to smell. You're going to tell me what you smell. What do you smell?
Alcohol.
Perfect. So central nervous system number 1 is intact. Next, we're going to do central nervous system number 2. So I have a chart right here. So it's 6 feet away because it's a smaller chart. It's the Snellen chart. Can you cover your right eye and tell me what is the smallest letters that you can read?
LTFPH.
Okay. Do it with the other one.
LTFPH.
Perfect. So you have 20/20 vision. Next, I'm going to do an H test and check Perla. I'm going to have you follow my light. We're going to nystagmus, looking for any, looking for the squirrel, look at my nose, look over at the camera, look at my nose. Okay, so Perla, patience follows, accommodates well. So that follows for central nervous system number 2, and as well as nystagmus, so that's also central nervous system number 3, 4, and 6. Next, I'm going to check number 5 for your central nervous system. So you have 3 areas. I'm going to either touch them with a sharp or a dull. Hold out your palm so you can see what they are. So this is a sharp, this is a dull, just so you have a feeling for it.
Okay.
So close your eyes for me. Which one?
Sharp. Sharp. Dull. Dull.
And then because he's got a beard, I'm going to aim for an area without facial hair.
Sharp.
Perfect. So again, that is central nervous system number 5 intact. Next, we're going to do central nervous system number 7. I'm going to have you go ahead and scrunch your face real hard, open your eyes real wide, give me a hard smile, a frown, and puff your cheeks with air. Perfect. So number 7 is also intact. Next, we're going to check number 8. We kind of did that with the Weber-Menace test, but I'm going to do it a little more specific. Close your eyes for me real quick. I'm going to make some noise. Tell me which ear you hear it.
Left. Right.
Okay, now I'm going to whisper 2 words in each ear. You're going to repeat them.
White Sox. Red Sox.
Perfect. Are you a fan of either of those teams?
Red Sox.
Perfect. We also have a minor cognitive intact. And we'll go ahead and do that right now while we're at it. I'm going to have you memorize 3 words. And I'm going to go ahead and do a small exercise, and then we'll readdress those 3 words.
Okay.
The words are red, truck, and tree.
Okay.
Count from 5 to 25 by 5s.
5, 10, 15, 20, 25.
Perfect. What were the 3 words?
Red, truck, tree.
Perfect. Mini cog is intact. So telling from his talking to me and everything like that, say ah. Okay, hang on. I'm going to look at your mouth, and we'll do central nervous system numbers 9 and 10 while we're at it. Stick your tongue out. Say ah. Okay, and gag reflex is intact. Found that out just now. And give me a swallow. So we got 9 and 10 knocked out of the way for that. And the mouth, I didn't see any abnormal redness, no masses. Do you have any pain, problem with your tonsils, sore throat?
No.
Perfect, everything follows in well with that. And the uvula moved up when he swallowed. Number 11, next we're going to have you move your head side to side, up and down. And go ahead and move your shoulders up against resistance. Number 11 is intact. Let me get this out for you. And then stick your tongue out. It is in the center of the face. Move it side to side. Central nervous system number 12 is intact. I'm going to go ahead and listen to my patient. So because of my type of stethoscope, it has a diaphragm and a bell in the same spot. So depending upon the pressure I put, it will give me both of the different readings. So we're going to start one for each side and then work our way down. Breathe heavy but normal. Back real quick. Okay. So breathing sounds are fine. His chest is symmetric when they breathe. No belly breathes. No actual rubbing heard. No pleurisy signs or anything like that. We're going to listen to your heart. We're going to start with the aortic, pulmonic, Erb's point listening to both valves, tricuspid, and mitral valve. So as well with that, we're going to palpate the PMI specific location. It's right here. Perfect. And that is fifth intercostal space. on the way down. I'm gonna look at your throat. So I'm gonna lift your head up for me. And any, hookah's fine, laryngeal prominence, cricothyroid membrane is intact. Give me another swallow. Covered that. Everything is good on that end. Next, I am going to have you hold your hands out for me. Face down. I'm going to check your cap refill. Looks great. Check your pulses. Radials. Obtuse. Dorsal pedis. And posterior tibialis. Those are all very good +2s. I'm going to check your deep tendon reflex while we're here. Have you hold your hand out. Face down. Check your brachioradialis. Perfect. And that actually tests C5 and 6. So go ahead and relax it. Good. And this is testing for C7, triceps, brachioradialis again. Very good. And you can relax it on my arm. Perfect. Triceps one more time. Perfect. Everything's good on that. And then kneecap, patellar, and Achilles. Okay. And then I'm going to change out scopes real quick. In the scope, I'm going to look at the discs of your eyes, so just look at my nose. Okay. Okay. So discs are red, orange is pink, which is normal, and that is a great finding. Next, we're going to get this scope. We're going to look at inside your nose, highly vascularized. So, if you have any problems with recurrent nosebleeds or anything like that?
No.
Perfect. Look up for me. No deviated septum. Airways look open. Go ahead and see if you can breathe through both nostrils for me. Excellent. So, continuing from that, I'm going to go ahead and have you lay back and look at your abdomen. Let's stand on this side of the patient. Okay, so now, first visual appearance, I don't see any abnormal masses, no herniations apparent. Palpation, you start from the ileocecal valve, follow my way over, no abnormalities or bruising, cuts, anything like that. Start listening, valve sounds are active, start in the ileocecal, move your way over to the sigmoid colon. I'm going to go ahead and do tympani real quick. Okay, and breathe in, breathe out deep. Okay, liver is good. Spleen is good. No hepatomegaly, no splenomegaly. I'm going to check real quick. I'm going to check Babinski. And then I'm going to draw a J on the foot real quick and look for your reflexes. Normal reaction. Normal reaction. It's okay to be ticklish. Abnormal reaction will be flaring back at the toes. Now you sit back up for me real quick. Okay, I'm going to have you stand up. No problems, dizziness, no balance problems.
No.
And while I had you sitting down, I forgot to ask, no bowel problems, irritability problems, anything like that?
No.
Okay, go ahead and take a quick walk that way. I'm watching your gait. It's normal. In line, turn around, heels to toes. Perfect. Now turn back, face that wall real quick. So no kyphosis, no lidoris, no normal concave, convex. Spine is in line, bend over. Spine is still in line, perfect. No scoliosis. So I'm going to have you hold your hands out like rolling a pizza and close your eyes. We're testing your balance and Romberg. Perfect. Go ahead and open your eyes again. Take a seat back down for me real quick. So from that, I'm going to do a sensitive, dull, sharpness sensitive on all your extremities, just like we did. Sharp, dull. Close your eyes for me. Let your arms relax. Uncross your legs. So tell me what ligament, left or right, sharp or dull?
Left arm sharp.
Perfect. One more time.
Right arm dull.
One last time.
Left leg dull.
Perfect. Okay. After that, I'm going to ask you if you have any other complaints, problems, or concerns.
No.
And if not, we'll see you back in a year.